Thank you for joining today's presentation from MassHealth and the Health Connector, where we will share information about renewing your MassHealth coverage or obtaining coverage through the Health Connector and resources for employers. You have joined the Employer Resources for MassHealth Eligibility Redeterminations webinar. We have a number of people who have joined today, but we will get started at noontime as scheduled. Hello and welcome everyone. I'm Erin from the Massachusetts Health Connector. I'm joined by my colleagues from MassHealth and Emily and Nikki Conti from the Health Connector, who will be presenting today's information. Together, we are here to share information about renewing employees' MassHealth coverage, obtaining coverage through the Health Connector, and how you as an employer may be able to support your employees. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, and then we will have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button that's at the bottom of the screen. We will be monitoring your questions throughout. We will hold on to them and answer them at the end. And if we have any follow-up questions for you, we will use the Q&A box for follow-up questions. When you do ask your questions, please do not share any personal information or private health information. Others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for MassHealth Customer Service and the Health Connector's Customer Service Center, as well as instructions on how to find help from a local assister. Also, we are recording today's webinar. Following today's session, you will receive an email with the presentation, as well as a link to the webinar, so there's no need to take detailed notes. And before we get started, I will just ask Nikki to join us, and I'll go ahead and pass it over to her.
Thanks so much, Erin, and thank you everyone for joining us. So as Erin said, today we're actually here to share information with employers about the MassHealth renewals process. So very happy to be able to present this session with our partners at MassHealth. And really, we just want to make sure that employers in Massachusetts understand, what is happening related to the MassHealth renewal process that began in April. So during today's webinar, we're going to explain, or Emily is going to explain, the renewals process, and we're together going to talk about coverage options going forward through someone may still be eligible for MassHealth, or if no longer eligible for MassHealth, we'll talk about how someone can get coverage through the state's marketplace, which is the Massachusetts Health Connector. We are also going to describe really how the employer community can best support people at this time. So you may have staff who right now are on MassHealth. So we really want you to be thinking of these three key areas as we are going through this information. So first, we're asking the employer community to help us spread awareness about MassHealth renewals. Secondly, as you're thinking about employees who may be joining your employer-sponsored coverage or your employer-sponsored insurance, we want you to consider extending your special enrollment period. And then lastly, we want to work with all of you to share information about your employer-sponsored coverage. So one of the things that we've done on the Commonwealth side is create a web page for you. You're going to receive a number of links. You'll get a ton of information, including anyone who has signed up for this presentation. You will get this entire deck, which has loads of information. So you do not need to take detailed notes, as Erin had said. So just to provide a little background and context, really as we're talking to employers across the state, we just want to acknowledge how important this relationship with all of you has been. So you really have been a vital partner and really have been involved in our state's success in reaching near universal coverage. So for those of you who really, you're not as familiar with this landscape or might not be thinking about it from this perspective, I think it's important for everyone to know that we currently have over 97% of our residents in health coverage. So we have the highest rate of insurance in the nation. So That is a pretty amazing position to be in. And we want to acknowledge that employer-sponsored coverage is a bedrock of this coverage landscape. So all of you have played critical roles in helping to inform the public about key changes over the years, particularly as we've gone through state and federal health reform, changes, implementations. As we've gone through all of this with changes to the health insurance space. So all of employers, we again just want to acknowledge this partnership, and that you are a trusted source with delivering information to your employees. And especially as we're thinking about what is going on in the Commonwealth right now with MassHealth renewals, and you'll also hear us slip between saying MassHealth renewals and MassHealth redetermination. We're really talking about the same thing. It really is one and the same. But as we're going through this process over the next several months, again, we want to lean on you, really engage with you, answer any questions you might have, and really just request your partnership as we're going through this effort over the next 12 months. So with that, if you want to go on to the next slide here, I think I'm going to hand this over to my colleague, Emily, just so she can explain and just provide some context of who MassHealth is. And then I'll do the same and talk about our relationship at the Health Connector so that folks understand why we're presenting this information together today.
Thanks, Nikki, and good afternoon, everyone. Thanks for joining us. Just to level set so everybody understands what MassHealth is and our involvement in providing coverage to folks in the state. MassHealth is Massachusetts State Medicaid and CHIP program. We provide health benefits and help paying for them to qualified children, families, seniors, and people with disabilities living in Massachusetts. And so our current caseload is up to about 2.3 million members in Massachusetts. And this represents significant portions of various populations within our state. So to highlight a few, about 2 in 3 people in low-income families have coverage through MassHealth, about 1 in 4 across the board Massachusetts residents, and 2 in 5 children of all incomes are covered by MassHealth. And so MassHealth provides and covers services that are comparable to commercial insurance, but also has some other services that are not traditionally covered by commercial insurance, including long-term services and supports and certain behavioral health services. So I'll turn it over back to Nikki to describe the connector.
Thanks so much, Emily. So as Emily's described, our state's Medicaid program, I just want to acknowledge that we're our state's health insurance marketplace. So we're the exchange in Massachusetts. So we're here to offer individuals, families, and small employers access to affordable health insurance coverage. Essentially, we're here to be a place or a resource for individuals who don't have access to coverage. We're here to be that place that they can get coverage and also may even get some savings as they're paying for those monthly premiums. So particular, specifically to this time frame, and also, as to why so many of you are here today, as we're talking about people transitioning from MassHealth who don't get health insurance through their job or another source like a spouse or a partner, we want to be the place that folks can turn to. A lot of people who apply for coverage through the Health Connector get some assistance paying, and some could even be eligible for a $0 monthly premium. You'll be hearing us talk about health coverage a lot during today's presentation, but I also want to acknowledge that we do offer dental coverage through the Health Connector as well. And an area that we won't be covering, but I think it's important for employers to know, we do offer a set of plans, or we have programs for small businesses. So those with less than 50 employees, less than 50 full-time equivalent employees can in fact turn to the Health Connector, and specifically Health Connector for Business, to see if they may want to offer coverage through our marketplace as well. So on to the next slide. I think we're going to, again, back to my colleague Emily, but she's going to dive into the MassHealth redeterminations overview.
Thank you, Nikki. If we can go to the next slide. So first, to start with some level setting about why we're here today, and in general are talking about MassHealth renewals this year. So at the beginning of the COVID-19 public health emergency, the federal government implemented something called continuous coverage requirements. And so in response to these requirements, MassHealth put protections in place that prevented members from generally from losing their coverage. And so these protections were in place from February of 2020 through March of 2023. And since then, the federal government has ended these continuous coverage requirements as of April 1st of this year. And so we have returned to our standard annual eligibility renewal processes. And this means that all members will need to renew their MassHealth coverage to ensure they still qualify for their current benefit or the best benefit they qualify for. And some members will not need to take action as they will be automatically renewed. And so, the renewals are taking place over 12 months from April of 2023 to April of 2024. Which means that members could get their renewal forms in the mail at any time during this year. And I just want to highlight that, because of these continuous coverage requirements, our caseload has increased significantly, about 25% in that time. And so this is a large effort that could include some of your employees or their members in their households who may be currently on MassHealth. So just to explain a little bit about what the renewal process will look like for our members. So we'll be renewing all of our members over a 12-month period from April of 2023 through the end of March 2024. And so how our process works is when we select a member for renewal, we will try to automatically process their renewal by matching the information we have against federal and state data sets to try to confirm their eligibility. If we automatically renew a member, they do not need to take any action. If MassHealth cannot automatically renew a member, then we send them a renewal form in a blue envelope, which I will show you what looks like in a moment, that they need to provide information and return to MassHealth within the deadline. So that upon receipt, that deadline that members have to respond is generally 45 days. Members in long-term care facilities have 30 days, and they need to submit the information requested in that renewal notice in order for them to receive the best benefits they qualify for. So members who are deemed no longer eligible, and some members who do not respond to that renewal notice may have their coverage terminated, but they will receive a termination notice at least 14 days in advance before their coverage ends, notifying them. In addition, there is what is called a reconsideration period, a 90-day period. And this is for members who do not respond to that blue envelope with their renewal notice and end up losing coverage because of that. If they respond to MassHealth with the needed information and we determine them eligible within 90 days after losing coverage, their coverage will be reinstated back to the date of coverage loss. So right now we are trying to have two key messages that we hope that you can help us pass on to members about how they can prepare for renewals. The first is to call MassHealth to update contact information. It's really important that members update their contact information, especially their addresses, so that we can reach them when it's their time for renewal. And to update address, phone number, or email address, we advise members to call MassHealth customer service at the number listed here to update that information. The second key message about how members can prepare now for renewals is to read all mail that could be from MassHealth. We send important information about members' health benefits that may require them to take action through mailed notices. And we are especially highlighting that members should be looking out for a large blue envelope in the mail that will contain a renewal notice with an important deadline to ensure that they can keep the best benefits they qualify for. I do want to highlight, in addition to the blue envelope, there are other important mailings that come in white envelopes that have call to actions, including follow-up information that may be needed following that blue envelope, such as requests for information or requests for verification. So this is a photo of what the blue envelope looks like and that members should be looking out for. And I will just highlight once again that important follow-ups to this envelope and important other mailings with calls to action will come from MassHealth in a white envelope. And for members who are automatically renewed, they will not receive a blue envelope and may receive a white envelope notifying them of that automatic renewal. We acknowledge that some members will no longer qualify for MassHealth, but want to make sure that they know that there are other affordable health coverage options in the Commonwealth. And so first highlighting our partners here, the Health Connector, and acknowledging and promoting the fact that MassHealth members who lose coverage is a qualifying event for the Health Connector, which allows them to enroll outside of the open enrollment period. Also want to highlight that for members over 65, there are other coverage options such as Medicare and other supports for funding Medicare, such as the Medicare Shared Savings Program. And there are additional programs such as Frail Elder Waiver and some through the Aging Service Access Points that can help with various elements of coverage. So I will turn it back now to the Health Connector folks to go through their section.
Thanks so much. All right, so let's talk a little bit about those folks who may be transitioning to Health Connector coverage. So as we look at the population who is going through this renewal process, we're anticipating that approximately anywhere between 100,000 to 200,000 people may be losing their MassHealth eligibility and becoming over to the Health Connector. So as Emily mentioned, we are working to engage many partners with a broad statewide campaign. And it's really designed to ensure that members who are, understand that they need to take action now. They need to pay attention to any mailings received from MassHealth, but also understand that once they move off of MassHealth, that they do have an option of getting coverage through the Health Connector. So from the Health Connector side, we want to ensure that members review their eligibility. So we're encouraging people to visit our website at mahealthconnector.org, call customer service, or visit a local navigator. And we'll talk a little bit more about this, but essentially there are many ways that individuals can get free help, many in their community, and people can also get help in their own language if they need assistance in a language other than English. And these folks can help people update their application, see what coverage they qualify for, kind of savings they can get, and can even, help them get enrolled. So first, we want them to review their eligibility. Secondly, we want them to understand what their insurance options are. So the Health Connector offers plans through multiple insurance carriers. And again, I've mentioned, I've already mentioned the free help from enrollment assisters. And, these folks, your employees who are current MassHealth members may have a particular relationship with physicians or other providers or specific medications. So they really, want to ensure that whatever plan that they move into, these things are covered, these physicians or these providers are part of their network. So as people are comparing insurance plans, we do have a variety of shopping tools that they can use. And then lastly, enrolling in a plan. So that is, it's really going to be important that people understand that they need to take action. This isn't something that is going to happen automatically for them. They're going to need to choose the health plan that best meets their needs. And if they're going to need to pay a monthly premium, they're going to want to compare and contrast what's available to them and, choose what is going to be best for their budget. In terms of enrolling, they can do this online, they can do this over the phone, and people can, take action sooner, right? We don't want to just discount that. But we want to ensure that everyone knows that on the Health Connector side, we do have an enrollment deadline each month, and that is the 23rd of each month. So if somebody needs to pay a monthly premium in order to enroll in a plan, they're going to need to make their payment. They're going to pick their plan and make that payment by the 23rd before their plan can start the next month. If someone does miss a deadline, they still will have opportunities to enroll, but they may have a gap in coverage. So one of the reasons why we're working so closely with our partners at MassHealth is we really want to try to minimize gaps that a person could have in coverage. We'd really would like to try to see someone transition if they need to, and if they're no longer eligible for MassHealth and need coverage through the connector, we'd like to see them transition as smoothly as possible into their next coverage. So on to the next slide. So from your perspective, when you're thinking about your employees during this time, if you're going to basically have a sense of whether or not those folks that are working for you are benefits eligible. And if someone does not qualify, or if they don't have access to health insurance coverage for their job, we really want your assistance in letting folks know that the Health Connector is the only place where individuals and families can access state and federal subsidies. So at the outset, we explained MassHealth is our state's Medicaid program. We explained the Health Connector is our state's marketplace or our health insurance exchange. So a lot of people, if they're coming over from MassHealth and do choose to enroll in plans through the Health Connector, may find that they're eligible for financial help. Now, that financial help is going to come to them in the forms of state and federal subsidies. And this mix, however, essentially, this mix of savings helps to reduce the members' costs. It helps to reduce the monthly premium. So we have a program in Massachusetts at our marketplace called the Connector Care Program that leverages federal and state dollars. And if somebody is found eligible based on their income and all of the other eligibility requirements, and you can see in the chart below that we are, our plan types are organized by federal poverty level. You could see that here that someone, if they're eligible, could enroll in a plan for $0, or if they're in a higher income bracket based on their household composition, they could choose to enroll in a plan for $137 a month. So really depends on the individual, their family, their tax household, as to what types of savings could in fact be available to them. One last point before I move off of the slide is just the fact that anyone who enrolls in coverage through the Health Connector can be assured that all of our health insurance plans meet state and federal standards. So if you go on to the next slide, I just want to talk a little bit about what, or show you a little bit about of our website and what employees can expect. So if someone isn't eligible for coverage through their employer, they can come to our website, mahealthconnector.org. We also have the application available in Spanish, and the link here, it's essentially mahealthconnector.org with /ES at the end. Now, it's really important to say this, and I don't think we've acknowledged this. Although MassHealth and the Health Connector are two separate organizations, two separate entities with different plans and different coverage options, we do share one common application, and that is the application at mahealthconnector.org. So your employees, if they had previously applied online or used, the online portal, they don't need to create a new account, but rather they want to sign into their application. And if they're having difficulties with that, or any step along the way, they can call customer service at 877-623-6765, and they can help them with the logging in process. We don't want to discourage anyone who even might have missed or thinks that they missed their window to respond or enroll in coverage. We really just want to encourage people to come to our website, update their information, and know that because the Health Connector has established an extended special enrollment period, people who receive a special enrollment period anytime after April 1st will have this, has this qualifying life event because they've lost their MassHealth coverage, and their enrollment window is extended through November of this year. So I think these are some of the key things to remember. One, we share the same application with our state's Medicaid program with MassHealth. And then two, even if someone has missed deadlines, what have you, please don't discourage them. Let's get them into their application, update their information, and we can help them take it from there. So on to the next slide. I talked about this briefly, but you may be talking with MassHealth members, your employees, and they may be thinking, okay, well, how do I, am I going to be able to afford this? How can I figure that out? We have a get an estimate tool available on our website, and all the person needs to do is just enter some very basic information about themselves, including the number of people in their home, an estimate of what they're making for income for the year, and we can see, and their ages, and they can see based on where they live, what plans may be available to them and what they may be able to get in savings. So again, this is simply an estimate. They would know what their final costs and plan options would be only after completing the online application, or completing an application. Now, in terms of someone ensuring that they are choosing a plan or choosing a new plan that maybe has the same physician or is able to provide them with a particular medication, we do have a plan comparison tool that they can use. And again, they don't need to go into the application to use this tool. They can go off of our website and just do some searching on their own. Now, again, you'll probably hear me say this a number of times, but if someone does need to make a premium payment. So again, remember, employees are going to need to take action. This is not going to happen automatically. They're going to need to select a plan. They're going to need to enroll. Our deadlines each month of the 23rd of the month to ensure coverage is effective the first of the following month. So as we're looking at the month of May, if somebody was seeking coverage that began on June 1st, they would need to take all of those actions by May 23rd. And lastly here, I think we want, and this is really important, that in something that we're asking of employers, we want folks to beware of entities that are mimicking, our state site, or don't offer comprehensive insurance coverage. So as employees are asking for your help or looking for information, please direct them to mahealthconnector.org or our customer service number, which is listed on, in this presentation, but also on the materials that you can share with them. So on to the next slide, or this next section, I think I've been talking a lot about different ways that we're asking employers to support their employees through this process. So again, just repeating or reinforcing what we've been saying is really need your assistance spreading awareness about this process. And really encouraging them, if they are on MassHealth, that they're going to need to respond, open that blue envelope, and take action. If they're having difficulty and they don't know exactly what it is that they need to do, get some help. And we've got, again, you'll get all of this information, but again, they can get local help to understand what it is they need to do next. Now, we've created a number of toolkits. So this link will bring you to mass.gov. It's going to bring you to actually an outreach toolkit where you can download posters, you can download social media tweets, etc. The number of items here that you can use to help spread awareness. Separate and different, let's talk a little bit about extending special enrollment periods. So, as we said, people will be losing MassHealth. We anticipate people will be losing MassHealth, and they will qualify for Health Connector coverage. But there are going to be people who may be eligible for affordable offers of employer-sponsored insurance. So because this is a qualifying event, there is a 60-day window to sign up after losing MassHealth. So just want to acknowledge that loss of MassHealth coverage or Medicaid coverage is a HIPAA special enrollment event, and that typically allows eligible employees or dependents to request enrollment in your company's health plan within 60 days. But we are employers are strongly encouraged to extend this special enrollment period beyond the minimum 60 days required by this statute. And this action is in line with the special enrollment periods through the exchanges during this, national Medicaid redetermination process. And some employees are already eligible for longer special enrollment period under emergency relief. And so again, we just ask you to take a look at, your policies, et cetera, and consider extending your special enrollment period. And lastly, do share information about your employer coverage. Someone may have been in a protected state, like protected under MassHealth for some time, so they might not even really have been thinking about you as the employer, your employer-sponsored coverage. So if somebody is trying to figure out what it is that they need to do next, it could be that they are, interested in enrolling in coverage. However, they may not feel that it is affordable to them based on, their situation. So if they need assistance with completing the affordability worksheet, they will be coming to you to gather information about your employer plan. So if any of you are brokers, again, we just encourage you to reach out to your current groups just to ensure that clients are aware of all of these changes and are prepared to help with spreading this information to their employees. And if you go on to the next slide, just a few other key points here. If someone is eligible for employer-sponsored coverage through their job, do help them enroll right away so that they don't experience any gap in coverage. And during this time, not only can employers add employees to their coverage during this transition period, but spouses and dependents losing MassHealth can also be added. And if the employee is not eligible for ESI, please direct them to the Health Connector for coverage and encourage them to take action quickly so they don't have a gap in coverage. And lastly, not that we want this to be what's driving someone to make this decision or take action. But I think it's also a good reminder to tell folks that, we do have a requirement in Massachusetts that all adults have to have health insurance coverage, or they could face a tax penalty. So again, not that we want that to be the, main message here. We do want people to be enrolled in coverage. So going on to the very next slide here. We've talked a lot about materials. I've explained that we've got links to toolkits. MassHealth has a website that talks about renewals, but we also created a similar webpage on the Health Connector, specifically with information for employers. You'll find things like FAQs, we've got flyers, and then also information about upcoming webinars for individuals and families. So not only are we co-hosting sessions to ensure that employers, brokers, et cetera, understand what's going on, but we are hosting sessions for individuals and families. So the next scheduled session is in June on a Wednesday at noontime. We're also working to schedule some additional sessions. So do go to our websites to find this information. And if you have other colleagues who need this, they can always view the recording. They can come to a scheduled session so that they can ask questions. But we just do hope that this has been informative, and know that there are more opportunities to have this information, get this information delivered and have opportunities for Q&A. All right, so I think I'm going to hand this back over to our colleague, Erin. And Emily, I guess you and I can be here.
Great. Well, thank you so much, Emily and Nikki. That was a lot of information, but a lot of important and helpful information. And we do have questions that we've received that we'll start off with. But again, for everyone attending, as these questions are asked, if it jogs more questions in your mind, please continue to use the Q&A functionality at the bottom, and we will get to as many questions as possible. Emily, I think I'll start with you. One question, just very generally, if we could review the renewal timeline just once more, just very high level, and specifically with a question in mind of when a person responds to the blue envelope, what is the turnaround time? When will they know if they're keeping their MassHealth or if they need to go to the Health Connector to seek coverage? How long generally should a person expect to wait until they hear from MassHealth?
Thanks, Erin. Yeah, if we can go to, there's a slide, I think, in our appendix that has the renewal timelines for the first part of the question that might be helpful visual aid. Okay, thank you. So just again on the process and then getting to the second part of the question. So again, when a member is selected for renewal, the first thing MassHealth does is try to automatically process that renewal by matching information against state and federal data sets. If we cannot automatically renew a member, that's when we send out that blue envelope with a renewal notice. And so typically members have 45 days to respond to that renewal notice. Please note, folks in long-term care facilities will have 30 days to respond. If a member, one thing I actually didn't touch on previously, but if a member returns that blue envelope and we need additional information, we are going to send a request for information. Members will then have an additional 90 days to respond to that request for information. So if a member does not respond, some members who do not respond, or if a member responds and they are deemed ineligible, they will receive a termination notice at least 14 days before their benefits will stop. And the last timeline piece is the 90-day reconsideration period. So for those members who do not respond to the renewal notice and are terminated because of that failure to respond, if they contact MassHealth within 90 days of their coverage being terminated and provide the necessary information, and we deem them eligible, we will provide coverage reinstated back to the day they were closed. I do kind of to the second part of the question, there is some processing time from when members submit their information to when they may kind of hear back on their eligibility determination. They will be receiving, most members will receive in the mail a notification of that determination of eligibility. And always MassHealth members can call our contact center to see if they have outstanding documents they owe or ask questions about where they are in the process.
Thank you so much, Emily. And Nikki, I'll kind of send a second follow-up question to you on this. So an individual then finds out that they aren't eligible for MassHealth coverage anymore. They submitted their renewal and they are no longer eligible. How long do they have to take action to enroll through the Health Connector? Or what would the timeline be that you recommend?
Sure. So I guess it's really, how can I say this? I don't want to specify, they have this amount of time. I think it's going to really be, I think it's going to be necessary for people to think of the 23rd as a deadline to keep in mind every single month. So depending on when the consumer finds out that they're no longer eligible for MassHealth coverage, I think they're going to want to think about how, moving into a Health Connector plan for the first of the following month so that they don't have a gap in coverage. And then Erin, is there any, I guess, as I'm thinking about this, maybe it is worth noting that, like, if somebody, and we said this during the slides, but just practically speaking. So let's say someone finds out that they've, they're no longer eligible for MassHealth coverage. They don't have access to employer-sponsored insurance, but truthfully, they just have all these things going on and don't take action. And then it's 2 months go by and they say, oh my gosh, I gotta get to this. I've got to enroll in coverage. Remember that beginning on April 1st, we've extended special enrollment periods. So any person, whether they're losing MassHealth coverage or they have some other type of qualifying life event that would give them a special enrollment period, typically the Health Connector gives them 60 days to take action. But right now, anyone who has a qualifying life event will have an extension until November 23rd. So somebody should just take action as soon as possible, keeping that 23rd deadline in mind. Let me know if there's anything else that you're thinking that I didn't hit on, because I want to be sure that people kind of take away that there's time, but yet there is a deadline every month.
No, I think that's great. And just to drive home, the 23rd of the month, an individual needs to select the plan. If there's a premium associated, make that payment in order to have coverage for the first of the next month. And I will just do a follow-up question that we received that is slightly related, Nikki, regarding special enrollment periods and qualifying life events. What would you say to somebody who is asking if they should apply, even if it's not open enrollment and they don't know that they have a qualifying life event? So maybe a little bit outside of this process, but.
Sure. Outside of this process, but still related to the Health Connector and MassHealth, I think we would want anyone, if someone is seeking coverage and it's outside of open enrollment and they're not sure, or or they know they don't have a qualifying life event, they should simply come to our website, complete the information, answer all the questions, and first see. They might be surprised. Some people actually do have a qualifying life event and, may not have been thinking of it. There are, in addition to things like getting married, having a child, adopting a child, even moving from one part of Massachusetts to another part of Massachusetts can trigger a qualifying life event, or can trigger a special enrollment period. So there are opportunities there for people to gain access to coverage. So really, I would start there and then also contact our customer service center if somebody needs assistance. And there are things that can go further, which take a little bit longer, but just say, always apply. Some people, you never know what you're eligible for, and some people do qualify for MassHealth, and MassHealth does not have open and closed enrollment periods.
That's a great point. And Emily, I don't know if you want to add anything on to that, but certainly want to give you the opportunity.
Yeah, I think that's a great point to highlight, is that individuals and households can apply to MassHealth at any time, and there are no open enrollment periods that folks are contained to in terms of applying and getting coverage through MassHealth.
Fantastic, thank you. And so Emily, I have a question for MassHealth and the renewal process. Is it possible for someone to know when they can expect to receive a renewal process, or when they might be, selected as part of the renewal process?
Yeah, that's a great question. So there are a few ways. First, I'll say that members who have completed a successful renewal in the last 12 months, it's likely that their renewal date will be 12 months from their last renewal. So let me just play that out a little bit. If somebody has successfully completed a renewal, let's say in January of 2023, it is likely that they'll be selected for renewal in January of 2024. There are members who were protected as part of those continuous coverage requirements who did not complete a successful renewal in the last 12 months, and so they don't have that kind of annual cycle timeline set. But in general, for across the board for members, most members under 65 can create or already have an MA login account, and that's in a self-service portal. And in that portal, it'll say when their next renewal date is. There is some subject to change there, but that's a good source of information. And also members under and over 65 can call our contact centers, and most of them will be able to learn through the agents when their next renewal is scheduled for.
Fantastic, thank you. All right, I'm going to jump to a few questions that are all a little bit related to affordability. So this might go back and forth between MassHealth and the Health Connector. But the first question that I'll start with is about being eligible for coverage that is offered by an employer. So if an individual is eligible for their employer coverage, but they can't afford it, can they still get coverage through the Health Connector and possibly a subsidy along with that, or that financial help that Nikki had referenced?
Yeah, thanks, Erin. I'll take this one. Hi, my name is Kayla. So employees can choose to shop through the Health Connector instead if they're offered coverage through their job, but they won't qualify for state or federal subsidies if the cost of their plan is considered affordable, and that's under a federal definition. And Erin, I know there's a couple questions on this, so we can talk about resources to help people find that out.
Yes, you read my mind. I was just gonna ask, so what is affordable? How does an employee or an employer help their employee understand if it is considered affordable under that federal definition?
Yeah, so we have some resources. I will send these links in the chat. It is likely that employer-sponsored coverage might meet the standards for affordability, but we would say always check. We have a worksheet to help you calculate that. So I can send that in the chat, but I would just note that it is a little involved. So it's kind of on a case-by-case basis.
Great, thank you. And Nikki, I don't know if you have anything you wanted to add from the Health Connector side before I jump over to some questions we've received about MassHealth and premium assistance, but I will just pause there, Nikki, in case there's anything more. Okay, so Emily, we have received interest generally about the MassHealth Premium Assistance Program, and and I'll start with this first question: if MassHealth members can be enrolled in an employer-sponsored insurance and still receive MassHealth.
I think I'm going to pass this one to my colleague Val.
Great, thank you.
Hi, everyone. So the answer to that is yes. MassHealth members can have both MassHealth and a private health insurance, like health insurance through their employer or even Medicare. If a MassHealth member has private health insurance, they will not lose their MassHealth as long as they continue to remain eligible for MassHealth. And the way that it would work is if a member has private health insurance, that private health insurance would act as the primary insurer and MassHealth would act as the secondary insurer. Basically, MassHealth is always what we call the payer of last resort. So the two health insurances that the individual has would work together. And they would present both of their cards using the private health insurance as primary and MassHealth as secondary.
Great. And is there, Val, is there any open enrollment period for MassHealth premium assistance or anything related to that?
For premium assistance, there is no open enrollment period. And just to give a little bit more background, some of you may be familiar with the program known as premium assistance. Premium assistance is a MassHealth program that helps MassHealth members pay for employer-sponsored insurance if it's available to them and cost effective. If an individual is determined to be eligible for the premium assistance program, they do not need to wait for their employer's open enrollment period to enroll. They can enroll at any time as long as MassHealth, determines them eligible. Within Massachusetts law, we require that individuals who are eligible for MassHealth premium assistance be allowed to enroll at any time during the year.
Great, thank you. And how would an employer know if their employee may be eligible for the MassHealth premium assistance program?
If MassHealth determines that either an employee or even a family member of an employee is eligible for the premium assistance program, MassHealth would send a letter to the employer letting them know that the state may reimburse the employee for a portion of their monthly premium. It would tell the employer the health plans, or maybe it's just one health plan that's considered to be cost effective in those individuals who should be enrolled in coverage. And they would have more information about how to do so, and that they would be required to help that employee enroll within 60 days from the date of the letter. The individual also, the member themselves, would be informed about that so that they can work with their employer to connect to that health insurance that is available to them.
Fantastic. Thank you so much for covering all of that, the program generally, and those specific questions. I'm going to come back to Kayla and Nikki just as we discuss affordability more through the Health Connector. And so Kayla, as you noted, if under the, completing the worksheet, if an individual is found to not have access to affordable coverage, then they may be eligible for financial help through the Health Connector. If they do have access to affordable employer coverage, that individual may still be able to enroll in a plan through the Health Connector, but without any of those state or federal financial help. But so can you just talk a little bit about the worksheet? Is that something that an employer can assist an employee with? If it is, as you noted, it's, kind of involved?
Yes, absolutely. And I would definitely recommend that an employer and an employee sort of walk through this together. I think there's a lot of information that the employer will have to provide the employee. So I think that is absolutely the right way to approach it. And this is information too that an employee, for example, going back to your question about who can enroll in coverage if they do have an affordable offer of ESI. And I would say, if they do have that affordable offer, they will be ineligible for any subsidies through the Health Connector. So they would really lose out on any employer contribution to their coverage. And so that is definitely something I would want to highlight there. And I can just make sure also, I'll send in the chat just the page where we host the worksheet and all the resources for employers and employees on that topic of affordability.
Great, thank you. And I will bring another question over to MassHealth. This is about loss of coverage, and if it will specifically indicate if a person loses MassHealth and they're losing dental coverage as well, will the letter specifically note that they're losing dental coverage?
Off the top of my head, I'm not, I can't remember the exact language, but it will say the coverage type And so a member can look up at the very least if dental coverage is part of that coverage type. And so if they're losing that coverage type, they would also be losing dental coverage.
Great, thank you. Okay, and I will just, invite everyone to use the Q&A functionality again to ask any additional questions. We have about 5 minutes remaining. So welcome any questions that you might have after all of this information. But I will just say after kind of talking about the renewal process, there is just, if we can just kind of at one more high level review the timeline for individuals and what they can expect to do. And Nikki, I might ask that you also kind of talk about the Health Connector's 23rd deadline again and how they all piece together.
Yeah, so I'll try to go high level. If a member receives a renewal notice in a blue envelope, typically they have 45 days to respond. There may be follow-ups that they have additional time to respond to. If the member is deemed that they are going to lose coverage, we give them notice in advance. So we give them at least 14 days. So they might receive a notice in the mail that says, in 14 days or longer. There's some scenarios where they would give even more advance notice, your coverage will end, so that they potentially have an opportunity to act and minimize gaps in coverage if they're transitioning to another coverage type. And we'll also highlight if a member loses coverage due to a non-response to a renewal notice, they have an opportunity to provide that information to MassHealth. And if we deem them eligible, and they provide that information within 90 days of termination, they'll get retroactive coverage back to the date of termination. So hopefully that clarifies. And again, we'll be sending out these slides or be sharing these slides, so you'll have this timeline available.
Great, thank you so much. And I'll also just reiterate on this timeline that this will be happening over a 12-month period. And again, as you noted earlier, when a person is selected may depend on some factors, but this is not something that is happening all at once. So as an employer, as you're working with your employees, this might be something that your employees might be coming to you in the next weeks to ask about coverage that you might offer, or determining if coverage elsewhere is affordable. But this is a long endeavor. This is a 12-month endeavor. So, this will be ongoing and, kind of spread out over the course of the next 12 months.
And Erin, if I could add to that, I believe there's a slide, Nuri, if you want to look for the slide in the appendix that just shows like the different supports that a person can take advantage of. I think we have, let's see, here we go. Yes, perfect. You'll get this slide deck, you'll see all of this information, and all of this is available on our website. However, I think it's just important to note that there's a lot of free assistance available for folks. They can work with customer service, either MassHealth or the Health Connector. They can work with community partners, and these are folks who have been trained and certified as assisters, and they can help the person whether they need to, simply update their application, or they update their application and they find out they need to enroll in Health Connector coverage. So really encourage employers to, point employees to these resources. They are trusted partners. And then in terms of like informational webinars, briefly mentioned that we've hosted one already for individuals and families who are, we're interested in learning about this process. We will be doing these on an ongoing basis. However, if somebody who just wants to watch a recorded session at, off hours at night, wants to, rewind and go back, that is available. So do, again, spread this information, do share this information, and we will, do our best to help support from this side as well.
Thank you, Nikki. That's incredibly important information. And again, this presentation will be distributed to everyone who registered. So all of this information, the telephone numbers, the location of navigators. We also, have a certified application counselors program. So there are people across the Commonwealth that can assist with this as well. And of course, we have our employer resources page. Please visit it, as there are frequently asked questions available and answers available there. But we want to continue to engage with all of you and make sure that we are providing the support necessary so that you can help your employees, but that we can make sure that residents of the Commonwealth maintain health insurance coverage. So it looks like we are just at 1 o'clock, but thank you so much to everyone for joining and for taking time out of your day to learn about this important topic. And again, please look out for this email that will be coming with all of these resources. And if you should have any questions, please do reach out to us. Thank you.